Well, as you know, there are a variety of types of guides. There is the bone-supported guide, the tooth-supported guide, which is primarily what we're discussing today, and the mucosal-supported guide. They all have their advantages and disadvantages. The bone-supported guide was made specifically from just the CBCT, and it's very accurate in the mandible, but in reality, you have to do an extensive surgery, and if the Hounsfield units don't pick up small wisps of calcified structure, or the dissection doesn't move away all the tissue, it can interfere with the proper placement and seating of the guide. A tooth-supported guide appears probably that it's the most accurate at the present time. It requires that there's an optical scan merged in together with the radiographic scan, and it allows for minimal invasion when appropriate, and it can be used to facilitate the design of the restoration because it has tissue contours as well as bone contours. The mucosal supported guide is probably the more difficult one. It typically requires a dual scan with fiducials on the patient's well-fitting prosthesis. And that works great. It can work very well. And so it can allow for minimal invasion when appropriate, and also can be utilized to help the design and creation of the restoration. In this study by Ozan, they took planning as well as post-placement radiographs, CBCTs namely, and they compared the accuracy of bone guides and tooth-supported guides and mucosal-supported guides. And what they found was that the tooth-borne guides were considerably more accurate than the bone-supported or the mucosal, less deviation and more accurate placement. This next study showed similarly, there were a number of patients who had pre and post placement CBCTs, and they evaluated bone guides and mucosal supported guides. And what they found, ironically, was that mucosal supported guides were more accurate than bone supported guides, and bone supported guides had higher mean deviations. This is notable in that at one time we believed that mucosal supported guides would probably be less accurate. But if the prosthesis is properly seated and not tipped or tilted, and it's properly adapted, mucosal supported guides can be very, very accurate.